Hello everyone! Today our group will be discussing the local and global communication in multicultural settings and why it is relevant to our field of radiologic technology. As a future radiologic technologist, we all often interact with patients and colleagues from diverse backgrounds, so cultural competence is essential.
Effective multicultural communication is a critical component of quality healthcare, particularly in the field of radiologic technology. It's more than just a polite gesture, it's a fundamental principle that directly impacts patient safety, satisfaction, and treatment outcomes.
Multicultural background is the ability to communicate effectively with different cultural backgrounds. In healthcare, this skill is crucial. Every patient brings unique values, beliefs, and understanding. These differences help us adapt our approach to meet their needs. In radiologic technology, this means ensuring our patients feel respected and understood.
For instance, when we explain imaging procedures to patients, some may interpret medical terms differently based on their cultural context. Being sensitive to these differences allows us to build trust, ensure cooperation, and make the imaging process smoother for everyone.
In today's increasingly diverse world, radiologic technologists encounter patients from various cultural backgrounds, each with unique beliefs, customs, and communication styles. Failing to recognize and respect these differences can lead to misunderstanding, misinterpretation, and even medical errors.
Now, let's discuss why this is especially important in radiological technology. Firstly, to build patients' trust. Imaging procedure like MRIs or X-ray can be intimidating. When we communicate in a way that respect their cultural values, they are more likely to trust us, which can lead to a better cooperation during the procedure.
Another reason is accuracy. Miscommunication can lead to misunderstanding and even incorrect imaging result. For example, if the patient doesn't fully understand our instruction, then there is a chance that they might move during the scan. Clear and culturally sensitive communication can minimize this issue.
Lastly, effective multicultural communication help reduce health disparities. By understanding each patient's background, we can provide care that meets their specific needs, ensuring that everyone receive equal treatment.
For instance, a patient's cultural beliefs may influence their willingness to undergo certain procedures or discuss sensitive health issues. A technologist who is unaware of these beliefs may inadvertently offend or alienate the patient, hindering the establishment of trust and cooperation.
In a radiology setting, we serve diverse populations. Let's look at some of the specific challenges we might face.
One common issue is language barriers. If a patient speaks limited English, they may struggle to understand the instructions needed for a successful scan. In these cases, we can use simple language, visual aids, or even request an interpreter if available.
Cultural beliefs about health are another factor. Some patients may have radiation about medical certain procedures. If we understand those beliefs, we can approach those patients with more empathy and helping them feel comfortable.
And then there are some concerns around modesty. In some cultures, modesty and privacy are highly valued. By being aware of this valued, we can adjust our approach, like offering additional coverings that can help put patient at ease.
Moreover, effective communication is crucial for obtaining accurate patient history and conducting thorough assessment. Cultural differences in communication styles, nonverbal cues, and levels of comfort with physical touch can significantly impact the quality of information gathered.
So, what skills do we need to communicate effectively in a multicultural settings? The first steps
is active listening. By listening closely to patients, we can understand better to their concerns and respond appropriately.
Next is empathy. Showing empathy helps patients feel valued, building stronger connection between them and their providers. In a field like radiology, where procedures can be intimidating, empathy can make a big difference.
Adaptability is another key skill. Being able to adapt our communication style based on each patient's background help us deliver clear instruction and better care.
Finally, awareness of cultural norms is important. For example, eye-to-eye contact may be perceived differently in certain language that can help us communicate more respectfully.
Imagine a patient who doesn't speak English well is scheduled for an MRI. Without clear instructions, they may not realize they need to stay still during scan.
In another example, a patient from culture that values modesty may feel uncomfortable during an imaging procedures. By offering additional coverings or explaining in more details, we help that the patient feel respected at ease.
Finally, some patients may have misconceptions about radiation. By explaining the safety protocols and the purpose of the imaging, we can elevate their fears and make them more comfortable.
Multicultural communication is not a luxury but a necessity in radiologic technology. By embracing diversity, respecting cultural differences, and actively seeking to improve their communication skills, radiologic technologists can deliver the highest quality of care to all patients, regardless of their cultural background.
First, cultural competence is essential. Understanding and respecting cultural differences help us gain our patients' trust and improve the quality of care.
Second, communication skills directly impact patients' outcomes. Clear, culturally sensitive communications can improve patient cooperations and lead to a better imaging results.
And lastly, by adapting our communication to meet each patient's cultural needs, we can help to create a more inclusive healthcare environment.
And reflection on the importance of multicultural communication in radiology technology, it's clear that our interaction with patients are deeply influenced by cultural backgrounds. Effective communication not only fosters trust but also enhances patient cooperation during procedures, ultimately leading to improved imaging outcomes. By understanding and respecting diverse beliefs and values, we can create an environment where patients feel comfortable and valued, which is crucial in a field that often deals with anxiety inducing situations.
Local and global communication is vital in radiologic technology. By developing these skills, we can ensure that all patients feel respected and understood, by leading to a better outcomes and stronger healthcare system.
The skills outlined in our presentation, active listening, empathy, adaptability, and cultural awareness, are not just essential for patient interactions but also contribute to our professional growth. As we develop these skills, we become better equipped to navigate the complexities of a diverse healthcare environment. This cultural competence will not only enhance the quality of care we provide but also help reduce health disparities, making our practice more inclusive and equitable for all patients.
Thank you for watching, and we hope you've gained insight into the importance of multicultural in our